A new report shows many rural hospitals across the U.S. are bleeding money, some in Missouri apparently on the cusp of closing. Joe McLean looks at the problem and a possible cure.
This report shows 8 of Missouri's rural hospitals are in immediate risk of closure. 6 in Illinois, 29 in Kansas. That's the most of any state. I spoke with state and national experts to talk about what's putting so much pressure on these smaller facilities.
Small rural hospitals are just plain more expensive to operate than urban ones. Experts say it's because fewer people visit them for procedures, it's more difficult to hire in those areas, they're less accessible, and they're not reimbursed the same through health insurance plans. A report compiled by the Center for Healthcare Quality and Payment Reform shows hundreds across the country are in dire financial trouble. Harold Miller is the center's founder and CEO and says these small hospitals are often vital to their communities.
Not only an emergency department, but laboratories, imaging, even primary care in some cases are supported by rural hospitals. And so when a rural hospital closes, it may mean that there's literally no healthcare services left in the community.
10 rural hospitals in Missouri have closed since 2005. 57 remain open. Heidi Lucas heads Missouri's Rural Health Association and says federal resources during the pandemic did help alleviate financial problems.
It was able to kind of lift them up a bit and help keep them in business for a while longer. However, now that that money's dried up, we need to really look at the root of the problem, which is reimbursement rates.
Because smaller hospitals don't have as much bargaining power with insurance companies, they'll often get reimbursements that don't cover the cost of providing the services. And meanwhile, those costs have continued rising.
All health insurance plans need to pay adequately for health services in rural areas. It doesn't do any good for someone to have insurance if they have no place to use it. And if you don't pay adequately for the services in that community, then you're not going to be able to maintain those services in the community.
A new law in Missouri changes the definition of hospital to now include rural emergency centers. That opens the door for some of these small facilities to apply for millions in federal dollars. In Jefferson City, Joe McLean, KY3 News.
The report does not specifically name the rural hospitals currently at risk of closing.
School